We're going to turn now to medical news. A new study says women going through menopause could suffer hot flashes much longer than previously thought. The duration of symptoms vary depending on a number of factors, including race. Dr. Suzanne Steinbaum is the director of women's heart health at Lenox Hill Hospital, and she's here in our New York studio. Dr. Steinbaum, good to see you.
You too.
Man, I hate to admit it, but this is a study that is of interest to me as I creep up in age, and it's bad news. Just talk about the nuts and bolts of what this study found.
I have to tell you, nothing has changed. Women would tell you their menopausal symptoms last a really long time.
So the research caught up to the reality.
Exactly. I think women would argue that they know. The reality is about 80% of women get hot flashes. And what this really is a drop in estrogen. And with this drop, you get what we call these vasomotor symptoms, these hot sensations in your face, flushing, and night sweats. And now what this study shows is that these can last up to 14 years.
Oh, that's just awful news. That's just absolutely awful news. Let's talk about a couple of the aspects of what they found here. First of all, in the study, they found that women who started to experience hot flashes before their menstrual period had ended tend to have them longer. Oh my gosh.
I know. So what this really is about is what we call this perimenopausal phase, when women are sort of irregular in their menses. And if hot flashes begin before menopause hits, it could actually last for up to 12 years in total, 9 to 10 years after. But the interesting piece is most women develop these hot flashes in perimenopause. About 1 in 8 women get it then, and 1 in 5 women will get it at menopause.
And there's also a disparity, if you will, and I'm not sure that's quite the right word to use, but a difference in the severity and the length of hot flashes based on ethnicity. African American women tend to really take it hard.
This is the piece that I think is new, that we're seeing that African American women, Hispanic women, they actually go through more significant hot flashes for a longer period of time compared to white women or Asian women. The other piece to this is that we see that hot flashes in this study are associated with stress, depression, and anxiety. And what I really think we need to understand is what comes first, not sleeping and developing stress, depression, and anxiety, or having it and then causing hot flashes. The best thing to do is talk to your doctor. Every woman isn't individual, and it doesn't mean you're going to get it and be stuck with them for 14 years.
Is it a foregone conclusion that whatever a woman experiences in menopause is genetic, whatever her mother experiences, what she's going to experience?
Absolutely not. We know that exercise, how much you move, what you eat, if you sleep, if you really take care of yourself, that actually decreases the symptoms of menopause. And if you're someone who has undergone surgery or is taking medication that puts you into menopause, clearly that's not a genetic component. But you are in control of your life, and you are in control of how bad these are and the duration of them to some extent.
I want you to unpack just a little bit more this connection between having hot flashes and those that suffer with things like depression and anxiety.
I think what's interesting about this is that oftentimes hot flashes are associated with really these night sweats, which really prevents a lot of women from sleeping. And that leads to stress, anxiety, and depression. So really, what comes first? I think the piece that we have to understand is that managing stress, managing depression is an integral part of preventing these night sweats and how bad they are. And sometimes that's medication, sometimes it's exercise, but it's always about self-care and putting yourself first.
Very quickly before I let you go, is there a health risk to hot flashes, or is it just inconvenient?
Well, this is the thing. The women who tend to have hot flashes tend to have an increased incidence of cardiovascular disease. Studies have shown that exercise can reduce hot flashes, and it certainly can reduce cardiovascular disease. Minimizing your stress, getting out there and moving, that's really some of the best tips I can give you for preventing this.
All right, Dr. Suzanne Steinbaum, as always, thank you so much.
Thank you.
Good to see you.